Good afternoon, Senator Burr and Senator Tillis. My name is Lauren Haynes. I am a registered nurse in the Winston-Salem area of North Carolina, and I have been a nurse for about 2.5 years. I currently work in the Children's Emergency Department and have previous experience in other departments in a hospital setting. I am also a student pursuing nurse educator for my master's. So I have a variety of background and knowledge of the nursing and healthcare professionals inside and outside the hospital setting. But specifically with COVID in the past year and a half plus, I have seen what the pandemic has done to my fellow co-workers. With this, I have found that the bill S610, Dr. Lorna Bryn Healthcare Provider Protection Act, is one of importance that I think we should stress more and support. This bill brings up how healthcare providers need to have mental health support and resiliency, education, awareness, training, and other things that they can use to help during this time of need with the pandemic and taking care of patients with lack of resources, lack of support, high demands of patients being seen every day in the emergency department, lack of anything and everything in the hospital setting, to wanting to leave the healthcare profession altogether. I currently see this on a daily basis in the emergency department. I have seen how our numbers and patients have gone up with our healthcare providers feeling like they're not doing anything, that they can't help the community that they live in, or that they're not doing their job to an extent that they feel they could if they had the right support and resources. And this is why I feel this bill is so important to us, because we as healthcare providers take care of people, but we don't always take care of ourselves. And when we don't take care of ourselves, it can lead to things like substance abuse, suicide. It can lead to stress in our family. It can lead to things that you might not think are connected, but divorce, not being able to take care of our own selves, our families, stress, and then ultimately we just want to leave the healthcare profession. So all this time, money, energy spent on our education and wanting to help people is not what we are doing. But this bill, if passed, would help support us healthcare professionals in ways that we personally can't do right now, because our healthcare system doesn't have the means or the funds to provide us with mental health or education or resources that we need so desperately in a time of this pandemic. So I greatly appreciate you listening to me, and I hope that you guys will both, Senator Burr and Senator Tillis, look at this bill and help pass it for all of us healthcare workers who currently have worked or in any way, shape, or form work in the pandemic. We so desperately need somebody out there to help support us in a time of need, that we are only doing what we can for the system and sometimes don't get anything in return. Thanks.